which stands, one vote, liberty and justice for all.
Roll call, please.
Peter Somerville, Town Councilman.
Edvin Hawken, Town Councilman. Sean Dolce, Town Supervisor.
Randy Bates, Town Councilman.
Brian Wood, Town Councilman.
Victoria Fraker, Town Clerk.
Okay, any audience comments, please? If not, Erin Nevins has discussed the health insurance renewal. She's not here yet. So we will continue on to the minutes of the July 10th regular meeting.
I'll move we accept the minutes of the July 10th, 2025 meeting.
I'll second it.
All in favor?
Aye.
I abstain. Budget modifications and transfers. I do have one that I'm going to pass around. And this is transferring from the Vogue Fund 050302 to the Parks Rensselaerville Reserve 7143 R2280 for $4,000. And this was the $4,000 Mo grant that we are going to put in the budget. So $4,000 was awarded to the Rensselaerville Playground. We cannot cut a check to the Rensselaerville Playground for $4,000, so we're gonna add it to the budget line item. Okay, so I'm an aye. I'll sign in, I'll pass it this way.
You can just do a motion, you don't need to do a roll call. You can just do a motion. You don't need a roll call, you can just do a motion.
Okay,
I
so
make a motion, can you just read, I got it. I make a motion that we transfer the $4,000 from the Vogue Fund 050302 to the Parks Reserve Fund 7143 decimal R2280 for $4,000.
A second.
all in favor?
Aye.
Motion carried. I'll make a motion to pay all signed vouchers and bills.
I'll second it.
All in favor?
Aye.
Aye. That motion's carried. On the old business, I know I wasn't here last meeting, but I want to bring this up. The shipping container law, I'm asking the town board to amend it. So we have, I have pictures here for you guys to look at.
I saw it.
So we have someone that built a house, probably for $500,000. And this is what's across from their yard. So this is gonna, I don't think this is fair to the neighbors, and I believe that we need to protect our neighbors. I'm not sure if it complies with the current law, but at the very least, if this was across from your house, or if this was across from a neighbor who could complain, we have nothing to stand on. So I'm just asking the board that
So here's the first problem with it is, we don't have a shipping container law, right? We voted back then to
shed,
make shipping containers part of the accessory buildings.
yes,
So we're not changing a shipping container law. So whatever you change, you're changing to the shed, or what, I think Randy called it accessory building, but it's changing that. So like, I know what your intent is, and my thing always is, when does it stop? Like, where do we stop? So now you're gonna change and say you can't have writing on an accessory building, but what if you have an old shed and the roof's falling off, it looks like crap, now we're gonna pass a law saying that you have to have a new roof on your accessory shed? Because you could drive around this town right now and find a ton of barns and sheds and buildings that are falling down.
unsafe buildings. We
But
have,
they're not unsafe, they just look like crap, because they got stuff growing all around them, garbage around them, old tires, anything. And then you do that. I truly believe or understand what you're saying, but, you know, like if you're gonna paint it, like you say, oh, it's gotta be painted, then what color are you gonna paint it? Like,
well, I'm gonna modify that and say, You just can't have lettering and numbers on your shed.
So if somebody wants to put Trump 2020 on their thing, then you're gonna do it, or Biden 2028 or something. Then you're gonna open up a can of worms down the road where you can't put letters like freedom of speech, like what do you? I'm just trying to watch
Yeah.
the bigger picture here, right? So you can't have lettering on it, but somebody wants to have an outbuilding. There's tons of them out there that have, Trump 2024, or, no kings, or not my king, or something like that. I'm trying to give both examples from both sides of the aisle, but,
I'm just trying to come up with something. If we just let it go, if we just let it go, I don't think we're doing our citizenry any justice by allowing. I mean, to me, I absolutely hate these things. I think they bring down the neighborhood tremendously. I think that the neighbors don't care about their other neighbors, and I'm just trying to, at least it's my opinion, that I don't believe this is correct at all. And of course, I'm bringing it up to the board. If you guys don't, I'm one vote, but I despise seeing this.
Okay, what is it exactly you propose or would like to do about it?
My proposal is just not to allow the writing and the numbers on these stories. As long as you don't,
you really, honest to God, John, believe that they went out and painted that shipping container pink, that somebody wouldn't come here complaining that they had a big ugly pink shipping container in their front yard?
but at least
With no letters on it.
I
don't think
we're
they care.
doing something.
I know, but just doing something doesn't always mean
Yeah,
we're
it
doing the
does-
right thing.
It doesn't always mean you get the result you want.
Because if I'm thinking, here's two things. A, I mow my neighbor's lawn every day because they don't mow it, right? And I do it because I want it to look better. And if I put that across the street from my house, the snow stuff in it, and it had tan Kang on it shipping, and you said, Brian, you can't have those letters on there, I'm painting it pink. And then you're gonna drive down, you're gonna be like, well, cause I don't like government telling me what to do. And so when you say like we have to do something, it's like, be careful what you ask for, because you don't want the letters on there, but then I go out with pink paint and I spray paint it, then it's gonna be right back to you. And then you're gonna have to come here and say, well, we gotta do something to protect our citizens. And then it's, well, it has to be painted a neutral color, it has to be a natural color or something like that. And then I just feel like we're overreaching.
Yeah, I just think, saying you can't have letters on your container, I think it's a big overreach. It's just something up all kinds of issues, because it's part of the accessory structure law. Whatever you do in that regard is going to apply. And it just, there's no end to it. As Brian says, as you drive around town, there's plenty of things I don't like, but I'm not gonna make it illegal. It just, you just can't regulate every instance of every situation, because the consequences are unknowable, in my opinion.
I just want to state this, that, I see this and it's a complete turn off to, what about our comprehensive plan? I didn't research it, but how'd you like if you built a house across and all of a sudden this thing showed up?
John,
You have to just accept it?
I had the greatest neighbors in the world, and they sold their house to a bunch of scumbags that left their garbage all over the front ground. Like, and when I talked to Tim, he went out and there, like sometimes it's just bad luck. I understand. Like, let them sue them. Let them sue their neighbor and do a civil suit, and let them fight it out in court that it's an eyesore or something like that. Let them try it, because everywhere you go into town, you're gonna find something that you don't like, and you don't like shipping containers. I don't like garbage all over. My neighbors still have garbage there. When the wind blows, it blows onto my lawn. You know what I do? I pick it up and put it in my own garbage and get rid of it. I don't expect the town to say you can't have loose garbage. But you would think normal human beings, who knows if that's gonna stay there? If you built a $500,000 house, that doesn't disappear in a little while.
No, it's the house across the road,
That built $1 million house.
and that just
Was
appeared.
that there when he built the $500,000 house?
Well, originally, the foundation is there because it was a steel building, and the steel building was too close to the road, it had to be taken down, it had to be removed.
Okay.
So then a later owner bought the shipping container and set it on the slab where the building once was. So the other part of that equation too is if it's your neighbor and if it's troubling you, you can ask your neighbor, can I paint your container? Right?
But if they come to us and say, hey, what could you do about that? We're just gonna say nothing.
Yeah.
Yeah.
Okay, so that's, I'll never agree with it. I can't, I really wish we could do something about it. But if the board is thinking we can't, I'll accept it, but I won't believe that we can't do anything about it.
I'll even go one step further, John. If you feel like it helps you in your argument with them to prove where your stance is, make a motion to change it. We can just vote no, and you could just like, at least I did what I was supposed to do. It's the other morons on the town board that won't vote for it. I'm being honest, right? It's the same thing you guys did to me with the boat fund, right? Make your motion, and if we vote no, at least you made a stance publicly that you don't like it, then it's on the record, right? So, I mean, that's up to you, think about it, but you also have to remember that you, and pardon my French, but you piss off 100 others accomplishing anything, right? So at this point, like, if you change the law and somebody can't put a banner or a sign or a thing on the side of their accessory building because you can't have numbers or letters, you're gonna offend somebody somewhere else. And I'm not picking on you, but you don't like it when people don't like you, right? So you're not gonna win here. You're not gonna get a general consensus on doing this. You're gonna appease a few neighbors around a few shipping containers that are here. And then you're gonna aggravate, a whole other group. So, and you may be willing to do that. Like, I don't mind making people mad. Like, it is what it is. And I think if you're 100% on it, then you have every right to say, I make a motion that we amend this law, and if we vote no, then you're golden.
That's fair.
You know what I'm saying? Then they can let them come here and call us. Don't call me. I made a motion to fix it. But I'm in this situation. I had the nicest people in the world as my neighbors. They moved out, sold their house. They didn't know who they were selling to. You never do. People move in, grass grows up, garbage. I mean, the garbage around the house was so bad. I had to shove it in the garage with my skid steers. Like, it's bad, and it's still bad. And it's a shame, but there's nothing I can do about it. Right.
This one actually looks like it's fairly neatly done. There are some that are all cockeyed, not level, laying in the lawn.
I'm gonna make a motion then. I'm gonna make a motion to change the shipping container law or the shed law to make the shipping containers a little more presentable to neighboring homes.
I think that you have to make your motion to,
To eliminate the lettering
no, because
and
you can't change the law without having
a public hearing.
public
You need a
hearing.
second. Before we can even discuss it, it would need a second.
Right.
What would happen with this one? This would be grandfathered.
I
This
would
would
make
be
it
from now
retroactive,
on.
which is even more of a problem.
Yeah.
Right.
You can't.
Yeah, it won't work.
This would have to be for future
Yeah, and Nick is
containers.
right, so before it even goes to, well, you have to have a second.
I got an empty shack across from my house. Just sitting there, waiting to fall down.
It's worse than it did with.
I know.
All right, so I made a motion. Let's move on. Do I have a second? Motion not carried. Thank you very much. and we'll continue. Under new business, the speed limit reduction request for County Route 358. Jason told me that this speed limit reduction was from 352 to Crop Road. And this is a county,
Yeah, why are we dealing with a county highway?
Because we,
so
Between 352 and 359, where's crop? That's,
that's 359.
okay.
So that's the entire length of the road essentially. Right to the top of the hill.
Yeah,
From Fox Creek Road.
That's,
to the top
that's
of
how
the
I
hill.
was thinking.
What is it now, 55?
Yeah, but
It doesn't.
What do we want to take it to? 45, 40?
It doesn't say.
it doesn't say. It just says,
Well, it should say,
it says, attached, please find this form to initiate a speed study on County Route 358. This was prompted by a request from a resident. Please bring this to the town board's attention, and if they vote to approve it, forward it to the regional traffic engineer for evaluation. So it's from a resident. Do we, I haven't seen the county reduce the speed limit yet.
I can't imagine they would on that road. I
Yeah.
can't imagine.
there's no reason, it's a straight road. It's
You know, and the
55.
statistics that they have here,
Shows that average speed 49 to 55.
12-hour period from 1 in the afternoon until midnight. Of all the vehicles, 50 some vehicles, there's only one that exceeded the speed limit. One. So,
It's another thing, like, we don't enforce the speed limits that we have in the town, so we're gonna bore it down. And second of all, like, where does it stop? Like, if you're gonna do it,
exactly, there's no end to it. It'd
right,
be
so
the whole
then just
town.
do a
would be-
town-wide speed limit of 45 miles an hour, like Colony does, or one of those guys. And then you're done with it, right? So you do that one, and somebody's gonna be like 360, they drive really fast, which is
Yeah, I mean, it would be every road.
351, 352.
Every road in the county would be restricted, or town would be restricted.
Yeah, and I agree with Randy, I don't think they would anyways, we tried that on Pond Hill, and they basically, that's a road that you shouldn't be driving fast on, and they told us to pound salt on that one, so.
So,
I suggest we table it or nix it.
so I believe this resolution is not gonna go anywhere. I don't believe the county is gonna do anything. So,
Alright. So Lisa.
I make a motion to not fill out the TE-9C form.
I'll second.
Aye, motion carried. Okay. We'll go back to Erin. Hi.
I brought chocolate, sorry, I'm late.
But then you're forgiven.
I was busy
We were
getting
gonna-
chocolate.
We were gonna run you out of town during the chocolate. We were-
That's right.
So I'll just hand out chocolate first, just to
Yeah.
kind of sweeten the mood.
That's the important.
That's the important part, so. Sweet treats always work. I didn't forget. Did not.
You are awesome.
And of course. You two, who do a lot of work all year long with
They
me.
do, they do more work than we do.
Okay. Well, this time, I decided to hand you an empty folder, so everybody wasn't flipping around in it, trying to figure out what page I'm on. So I'll give you an empty folder to start. It's red, so you know which one you gotta go to when you go into the pile. Okay. First things first. So I spend a lot of time actual, I mean, this is really not something that most insurance brokers do, but I spend a lot of time with Carolyn and looking at your actual enrollment and plan usage and all of those things to try to give you the best analysis that I can, so that when you go to budget, you have some idea of how much money you should be budgeting for, not just here's your rates and here's a renewal. Most people do that, I don't do that. So this is like an active live working document that just keeps changing every time you hire somebody or let somebody go or someone quits or whatever. So I just want to caveat with that. So, you know, the Medicare stuff renews calendar year, January through December. The town's active MVP health insurance renews September 1st. A little bit of history as to why. Most towns are trying to budget well in advance. They have no idea what the rates look like. So we backed up the town's renewal at the time so that you had at least some idea of what you should be budgeting for. And they decided to change their plan year to September through August. So the purpose of tonight's meeting really is just to give you your September 1st renewal with regard to the MVP active enrolled people. But I know that you're in budget time, so I tried to include as much information as I can with regard to the Medicare stuff. I don't have any Medicare rates for next year yet. They're not out yet. So the MVP, I use this worksheet, and I'm happy to, it's been back and forth between me and Carolyn a lot. I'm happy to email you this final product for tonight's meeting. This is really just a listing of all of your employees. This is where all my numbers come from, okay? This is a listing of all of your people. And of course, you know, some people, the contribution towards the health insurance changes with based on when they were hired. So I had put their hire dates and color coded them so you could see who gets it paid in full, who has to contribute 20% with a max of $1,800. Then it changed again to anybody after 2008 has to pay 20%, right? So that's on there in detail. It's blue, yellow, and green. And then of course we have the actual employees that are bold. And then we have their family members that are not bold. And we also have retirees, surviving spouses on here too. So I tried to let you know the status of their enrollment, who they are on the left-hand side, because over time people start to not realize who these people are. So I indicated that. Their date of hires, so you could see when they were hired. And then also their costs across the board, minus their, you know, specific employee contributions based on the person. So a little deeper into that is these, so we did have somebody pass away and we've had somebody leave, and we also have somebody's spouse getting ready to turn 65 October 1st. So we have somebody shifting from active to Medicare on October 1st. These are your MVP people. And also on here, it shows you that the town is contributing either $6,000 or $12,000 to their health reimbursement account administered by MVP Healthcare. And of course, in yellow, you know, somebody's new, somebody came on, somebody came off, just so you could highlight some of those changes. Again, it's always a moving target because there's always enrollment changes. In addition to that, this is your health reimbursement account, your $6,000 or $12,000. You have basically your annual election based on enrollment was $132,000 of allowance that you allowed for. And what you have distributed to date is $51,060. And remember, the goal of the HRA is to ensure that People are getting a good plan. You're paying the lowest on a bronze level plan. They're not being harmed by out-of-pocket shifts. And as long as your HRA is running at around 50% or lower of your allowed amount, you're still doing well with that strategy. So right now, you're basically just under 50%. And this report was July 14th. So this is just a week ago.
That's a group HRA
Yep.
for the town employees only.
Yes, just the active people, not employees.
That doesn't go into their individual HRA.
No, it's a town allowance that is drawn from the town's bank account as the claims are incurred. So it's not like you took $132,000 and said, oh, here, we're going to give you this money and let us know. It's, hey, here's our bank account. Here's what we're allowing each person. As you're running the claims, you have permission to draft as the claims come in, not to exceed this much per person. So at this point, Carolyn gets the reporting as well. And at this point, this is kind of where you are in the mix. I do have a full report, but it does have people's names on it. And so, to be HIPAA compliant, I don't really want to pass that around so you can see who's using how much. But the administrator, Carolyn, is privileged to that HIPAA information as well as John. So if they need to look at it, they can look a little closer. I also, in addition, even though we're not talking so much about the retiree people, this is the retiree people. Right. So you have a full list of who those people are and how much you're paying for them. And then, of course, you have some dental and vision expenses. So here is dental, and here is vision. Dental and vision. So, your vision.
I'll probably ask this 2 more times while we go through this before I'm done. Can somebody explain to me the $185 a month, $1,800 a year for the retirees?
All right, so when people retire and they're no longer actively working, they're required to enroll into Medicare. The town
65,
at 65, or when they're no longer actively working.
correct.
And-
Whichever comes second, right?
Well, it's two things. The employer has to have under 20 employees,
Yeah.
right? So the size of the employer matters and the active working status of the person matters as to whether or not they can delay Part B. So no longer actively working means they have to go get it or else they will be personally penalized. So they could retire at 67 and then go get it, right? Without a penalty. Of course, we want them off as soon as they hit 65 because it's a little bit less money. So when they turn 65, they have to enroll in Part A and Part B. Part A is free, it's hospital coverage, and Part B, which is doctor test, that coverage. The standard monthly premium for that is $185 a month, charged to the person by Social Security through their Medicare and their Social Security deduction. It can never be billed to anybody but the person. So part of the town's insurance policy is to do a Part B reimbursement, which I think you do it twice a year? Once a year. I do a couple towns, some of them do it a little different, but. So that $185 is being auto-deducted from their Social Security check every single month, and the town reimburses for that Part B premium reimbursement. In addition to that, the town has a sponsored Medicare supplemental plan that we put in place. And that's the Plan N. And that has a monthly premium to it. And that mean A and B are primary coverage for people, and the supplemental plan just picks up all of their out-of-pocket costs with
Co-pays and deductibles.
with the exception of the Part B deductible, which is $257 a year, and a potential up to $20 office visit copay, not to exceed that unless it's the ER, it's $50. So that bill comes to the town, and those people have two cards they have to go to the doctor with. They use their primary coverage with Medicare, and the secondary picks up all the additional costs minus their cost share. And then we did have a standalone Part D drug plan that the town was doing the same thing with, right? But all of those, when the, I can't think of the name of the act, just recently through Biden, the act changed the Part D rules across the board, across the United States. When they changed it and capped every single senior citizen at $2,000 out of pocket and said, okay, we're capping all the drug costs at $2,000, all the insurance companies dropped those employer-sponsored Part D drug plans because they just couldn't make any money at it. So now these people are on the hook to go out and get a Part D drug plan. So I will tell you, I met with every one of them, some multiple times, over and over and over again. Even up until this last month, I'm still dealing with one person to get everybody analyzed with their personal drugs, select the plan, enroll them in a plan, and then in addition to that, the town, instead of paying the bill for the drug plan, decided to give each person $1,800 in a health reimbursement account, not through MVP. It's done through TASC. And so they can utilize the funds for plan premium or out-of-pocket costs, whichever they decide to use the money for. So in an effort to also save the town HRA dollars, I also spoke with many of your senior citizens and worked very quickly to get them enrolled in a state program called New York State Epic, which actually the state subsidizes people at a certain point for their drug costs, meaning they're not drawing down on your HRA for as much money. So I worked with a lot of people to get them enrolled in into Epic, just to kind of protect the HRA fund. So I could probably give you something via email to show you where you're at with that, but
The question I have as we begin to look toward union negotiations, we went through this last year, was we had to pass a local law that said that we would cover that $1,800 a year, because there was nothing that said that we would pay that. So we enacted something that would say anybody hired before a certain time. With the intent that moving forward, that we probably will not do that. But
So-
the question I have is, in all the municipalities that you work, how many of them pay that Part B?
all of them,
Up to 12,
different. Town of Greenville gives their people $3,600 in their HRA
That's,
to go get their own plan and drug plan. They don't even have a plan anymore. They just put out a $3,600 HRA and said, here's your fund, go do you. We don't want to be responsible for this anymore.
okay, so the question, I believe, is that we had an employee that got a bill for $600.
yeah, that's something different though. That's the.
Oh, that's different.
Yeah, that's the other one. That was my Part 2 question.
Okay, okay.
So we run into that. So so my question, first part is retiree, that 1,800. So we're looking at possibly doing away with that, but I also understand that's a recruitment thing too, right? So when we look at, we're the lowest paid municipality around, and now we're gonna cut back on what they get as retirees, that could potentially, we need to make that decision when we go into union negotiations. Second part was, we had an employee who ended up in this weird gap where, can you help me explain it?
We
Where he had
paid-
surgery and he had this deductible thing that wasn't picked up by the HRA account or the
We reached a $12,000 family where we,
Out of pocket.
out of pocket.
Okay.
So it was, say, $13,000.
Mm-hmm.
So above $12,000, because it was never specified to them, we're supposed to pay up to 6,000 and up to 12,000.
Obviously, we have to be careful because that's HIPAA too, so we can't say it. But, I mean, I can only say, can you just make sure that, like, we need to make sure that, right? That clearly was a loop. And I'll be happy to write it down for you, to look into it. But it was recently, and we ended up paying that employee because it was this strange thing where there was a deductible that wasn't met, but then it had to be met before the HRA kicked in, or the health spending account kicked in. And so he was really on the hook for $500 or $600, and it's not what we intend to do for employees. So I don't want to say his name because it's a public meeting, but I also want to make sure as we continue to go that we fix that.
Well, I can tell you that nobody on your, as of July 14th, $1,000 from their HRA.
This wasn't that, something to do with the plan, and it was. a
Is it
gap.
active person?
Yes. It's a spot between.
Carolyn, you have that information that you could give her, right?
Okay, all right. Can we just make sure that?
Yeah, I'll talk about
I
it.
check it every month.
Yeah, I mean, there's times when people don't understand their plan either. And there's times when doctors send in the bill.
Well, this employee had talked to you, I believe, and it was kind of like, and the conversation that we had back was, it was something that I don't think any of us understood.
That's where they reached their cap at 12 and then they weren't covered again until 18,000.
Something like
That
that,
gap in the middle.
and we paid,
Their out-of-pocket max, you mean? So,
yeah.
Is there something between the individual?
But we decided we were gonna pay.
I know, but I just want to see is it something that we just should add to our spending account, or do we have to change our plan, or?
well, I mean, you can change your HRA.
Yeah.
Right? You can make your HRA whatever you want it to be.
Yeah.
Right? So if you have 6,000, 12,000,
Hard to talk about it, like, you know what I mean, like Carolyn can do it, and then we can. like, and I
Discuss.
can't even talk about it because I don't even know the exact details because it's been so long. It was like 6-8 months ago that we dealt with that.
well, so are you saying that you want your employees to have zero out-of-pocket costs completely across the board, no matter what?
No,
No, we're not saying that. We're saying that that's what happened. Their expectation.
the co-pays and deductibles, what they normally pay are fine. Like it was this other, it was a weird, bizarre thing.
All right, well, I have to
Yeah, so
look
let's.
closely at it.
Yeah,
It might have been co-insurance.
It was something that,
I'm just saying, can we just? It's nothing big, I just want to make sure that.
That's what I'm asking, is your intent, so every single plan has an out-of-pocket maximum to the member. If you spend this much out of pocket, set aside the HRA account, that's just a fund, helping them pay for it.
Right.
Their plan says, if you spend this much out of pocket, we will then pay 100% of your covered services. So if the town says, well, we want to fully fund that out of pocket, then your HRA allowance would be increased.
What is the maximum out of pocket?
I think you have, silver 8, bronze 2, sorry. So the bronze 2, I'll hand this out to you. in a
They have a
second.
deductible, and then they reach the deductible, but not the maximum.
Out of pocket.
So the difference might have been between the deductible and then the co-insurance picked up, even though they didn't have deductibles, they still have co-insurance for above the deductible amount. So
They have,
that's how the plans read, they have co-insurance.
this plan has well, there's one co-insurance. Inpatient hospital is 30% co-insurance.
So if they reach the 12,000, or when they reach their deductible, but they didn't reach their maximum out of pocket.
Correct,
They can go above the deductible.
to the out-of-pocket
to the
max.
maximum out of pocket.
Right, so
But
if you're in.
with co-insurance.
Right, so is your intent to be that you want your HRA to be increased to cover their complete out-of-pocket maximum.
What is the out-of-pocket?
Well, I'll just hand this out. It's, your plan is bronze.
So if there's a $6,000 deductible, and you meet that, you still, is there such a thing of co-insurance, or 10%, 20%, 30% of the bill you still pay until you reach your out-of-pocket. So everybody thought the deductible was the cap, but once you reach the deductible, there's still, exposure to the co-insurance.
It's this plan. This is your renewing plan, bronze to EPO. Here's your new deductible, and here is your out-of-pocket max,
Then the two-
starting September 1st. It
And I'm not-
is your.
I don't have an
Wrong
intention. The
page,
thing
sorry.
is, I know that there were 5 people sitting around this table saying that was
This
weird how it happened.
Yeah.
That's your plan.
And so we did it. So like,
That's
we
your
need to
deductible,
make sure that our
and that's
employees
your
know
out-of-pocket
clearly,
max.
so down the road, they can't be like, "Oh, I never knew that was the case. Because 5 of us didn't know that was the case.
You
either.
thought the deductible was, they were done, but there is
That's
the
your deductible,
co-insurance you
that's
reach.
your out-of-pocket max. That's for single or family. Bronze to deductible, person, family, pocket max.
Is there a Cliff Notes version to explain that to me again?
I'll show it to you.
Okay.
I just want to hand it out to everybody first.
Brian, did you see where we are at the bronze,
Yeah.
number 2?
Yeah.
So now I recall the plan deductible, 6,150 and 12,300. But we only listed it as 6,000 and 12,000. We
This is
never,
as of September 1st, 2020.
I believe this was last year
Yeah,
also.
it was, was it 6,100? I have to
It
look.
was 6,150 and 12,300. But then out of pocket maximum, that's what happened, is that for the first time, this family went above the 12,300, which the HRA reimbursed. But we weren't gonna, but there was nothing saying that we're supposed to reimburse up to the 17,800. That was the situation.
Everybody thought that the max,
It was 6,000 and 12,000.
once you reach the deductible, you don't have any more expenses, but obviously.
So between the 12,300 and the 17,800, that's where the problem came in, because
Oh, right. So we used up to 12,000 for them, but they
They
still
still
had that.
Because of the co-insurance, there's no more deductibles, but they still had co-insurance for procedures. There's 30% if you're at a hospital facility. And
so I believe the whole town board was thinking that it was 6,000, well, 6,150 and 12,300. And after that, that was the maximum. But there's another line that says the out-of-pocket maximum.
Mhm.
So there's, for a family, $5,500, that's not covered. And that's the loophole right there.
And there's only one line item that would hit you that way, and that would be the inpatient hospital, because that is a percentage. All the rest are actual defined copays. So,
Well, I believe that's what it was hospital.
Right, with the surgery.
yeah. So you could alleviate it by just dictating how much you want to allow in your HRA, right? So is your goal to not have any out-of-pocket costs for these people, then max.
Look at, this is something that we're gonna, at the union contract.
Yeah, no, I think, I'm not saying that this is right or wrong, I'm just saying that
Right.
it needs to be explained in the contract, and it wasn't clear in the contract. It basically said, that you would have, like, we need to make sure it's clear, that this plan has to be part of the contract with the amounts, so that they know it.
At the time that the town changed to this strategy, people were paying out of pocket.
Right.
Once the town moved to this strategy, pretty much nobody's had a single out-of-pocket cost,
Correct.
right? Because no one's hit it.
Right.
So the goal at the time
Right.
of the town changing to this strategy was to say, well, we don't want to take everybody's co-pays away. We'll fund the deductible, but they should be on the hook after that for their co-pays, right? And so that's kind of how it started. But if you feel as a town board that you don't want that to happen, or you want to change your plan design,
Yeah, I don't feel anything. I feel like we just need to make sure it's clear so we don't get in that position.
That's right.
They need to know exactly whether it's, if they wanna invite you here for a meeting, or we can try to do it, like they have
I'll do a meeting.
an employee meeting so that they understand it.
Yeah.
Then I think that's.
And I have done employee meetings
Yeah,
about
I
their
know.
benefits in their shop.
Yeah.
Multiple times
Yeah.
since we've deployed this strategy. I haven't in the last couple years because they haven't asked me to do it.
Right.
But, so at this juncture, the decision for the town board is, okay, do we want to fund 6150, or do we want to fund the full out-of-pocket amount? This is when, for September 1st, that you need to decide
Okay.
what your goal is.
Yeah.
Whatever the goal is, I'm happy to amend
I-
everything for your renewal
Yeah.
to go forward, but it's whatever you guys want it to be.
Okay.
What you intended it to be.
The way it is.
Okay.
No, that's fine. I'm not, and again, I don't, it sounds like I'm coming across like
No.
the plan is screwed up that week.
No.
I just wanna make sure that, like, I can just tell you when it happened, we all sat here looking at each other going like, I don't know what happened, and then we're like, oh, some loophole, like, okay, then let's either, I think we just agreed at the time, take care of it out of the HRA money, and then we'll figure it out going forward.
Right.
So that's why I just wanna make sure.
Yeah,
I want them to understand, because I don't want to, like, that's your plan. Like, it's your contract, you voted for it.
yeah. I mean, I can't make people understand it,
Yeah.
No, but as long as it's in writing, it
I
doesn't
mean-
matter if they understand it or
The
not.
biggest problem as a town board member is that $1,800 that we pay for the Part B expenditures. I think that there needs to be some justification to why the general public that works a career their whole life that's not in municipal service has to pay their Part B, and then municipal employees don't. And-
My husband's a retiree of New York City. They pay it. The state pays it for state workers. I mean, municipal entities generally reimburse.
Agreed, but there's no explanation of why they do that, and now, and you're, it's just pushback from people that don't get it. I understand, but, the argument, there's never ever a good argument.
Well, the argument is, regardless of their retirement status here, or the state, or the city, you put in your time and they're promising you some benefit. But when you leave active working status, the federal government takes over and you are required to get that coverage. The town can then supplement that coverage, right, which is what you're doing. But
Right.
their main coverage through the federal government, that the town is now only paying $185 a month as opposed to $763 a month. It's just that the government's,
So the retirees, I just want to clarify this, the retirees have Medicare or Medicaid?
Medicare.
Okay.
Medicare.
So why is it costing us $74,000 or $8,000 a year for their medical coverage?
You're reimbursing their Part B, their $185 a month. You're paying $206 a month for their Plan N, and you're giving them $1,800 a year for their drug plan.
$185 a month for
12 months.
Part B,
for
for your Medicare.
For Part B, that's the Medicare, their primary coverage.
185. Plus you're paying $206 for their supplemental Plan N, which pretty much covers most of their because with original Medicare, you have a limitless 20% cost share, no out-of-pocket max safety net. It's a limitless 20%.
Right.
So this,
So if you go in and have cardiac surgery and the bill's $100,000, you have a $20,000 out of pocket. That's why you give them. Right, so if you retire, just Medicare, then you don't have a supplemental plan. You go in and have open heart surgery, and the bill's $250,000, you have to pay you have to pay
$50,000.
$50,000.
So the Part N is what covers,
The Plan N covers their out-of-pockets with the exception of an annual Part B deductible of $257 and up to no more than a $20 office visit copay.
And then 1,800 is for the, prescription. Yeah.
So 1,800 divided by 12 months is about $150 a month. So
435, 535, 540.
you're at 541. Your active people, you could just say, hey, as a retiree, we're going to give you this same insurance. They still have to go get Medicare, and your insurance is now secondary to their Medicare. But now you would be paying $763 plus $6,000 in HRA money. Right? It's just a different way of providing them a retirement benefit and not having to foot the whole bill. So when people come to you and want to pick apart, well, why are you reimbursing for Medicare? They have to go on Medicare. They're going to get a penalty if they
So
don't.
I'll ask this. So you have an employee that works at Minocqua Express. They work there for 40 years. They retire under Teamsters retirement. The Teamsters provides them health care out of their retirement. They still pay their own 185 out of their Social Security. What argument do we have to justify paying a town employee, but the guy who lives across the street pays his taxes here, has the same house, does everything else, has to pay 185? That's one. It may just be that's a benefit of working for the town if you should come here and apply.
Right. It's a benefit of working for the town.
And I bring that up only because it's easy for us to sit here and say we should cut it, right?
Right.
But when we're looking for people to come here and work, that's a huge perk to have down the road. You know, when people say I can make this much money at Carver driving the dump truck, our counter can be right, but when you retire at Carver, you're paying.
So in Greenville,
Yeah.
they have a union policy, which I am not the broker for,
Yep.
and I do the regular everybody else.
Yep.
When those people age out or leave the union,
They come back.
there's nothing for them. So the town then puts them on the commercial part that I do as retirees,
Correct.
and I'm covering them that way.
Yep.
So the union won't even keep them on their plans. But the 185 isn't like, oh, we're just, willy-nilly reimbursing everybody for their Medicare. If you do the math, you're paying $541 in essence a month, maybe a little less because they don't use their HRA. And if you said, well, we'll just give them retiree benefits, the same as our active people, you would be paying almost double that.
Correct.
So it's part of a strategy. It's not just, hey, we're reimbursing this.
Okay.
So how do these costs for retirees, how does this plan compare to a Medicare Advantage plan?
So this plan, with a Medicare Advantage plan, you are required, and this has become a big source of contention just this past year. I'm sure you saw CDPHP in the news with Albany Med. When you're on an Advantage plan, you are relegated to that specific network. If they don't, CDPHP falls out of network with Albany Med, you're not going to Albany Med, and you're not going to.
How does the cost compare?
So I'm just saying the difference between an Advantage plan and a supplemental
but-
plan, there is
I'm
no.
Talking about the cost of a Medicare Advantage plan
Yeah.
versus the plan that we.
The Medicare Advantage plan is actually more money because they tuck in some extra stuff. And, oh, here's a little dental, here's a little vision. Well, they already have dental and vision.
How much more?
I'd have to get you the number, but I know that I'm just trying to think off the top of my head what it was, but it was like $476 with drug, and your members have out-of-pocket co-pays for their plan. And they're
Yeah,
relegated,
max is at 2,000, like for drugs.
for drugs, but not for medical. They had like a $4,000 out-of-pocket max in co-pays for medical, and they had a $2,000 out-of-pocket
Right, but it
max.
exceeds a certain amount, like 100,000 or something. it's a higher mark, it's much more than. 'Cause
What,
that's the plan I have, so
no,
I'm familiar with it, so.
I'm talking about an employer-sponsored Advantage plan. You're talking about maybe a personally purchased Advantage
No,
plan?
it's a New York State.
Familiar with whichever one that you have. Their self-insured Medicare retiree program that they get to design. But the ones that are available to small group has, which you guys had at one point, and we moved it to the supplemental plan to save money. So they were outpacing the supplemental plan. We didn't expect that the drug plan was gonna get pulled all of a sudden, but it would still be less than if you went with the employer sponsor. So the town of Greenville decided to stop worrying about plans and designs and what they're giving, and just made an HRA and for their retirees, and they said, here's $3,600, go find your plan. And so some people chose to use their money for supplemental plans. Other people chose to go on a free Advantage plan and use the $3,600 for other parts of their out-of-pockets, but they have a $3,600 HRA.
How do they claim it? Do they have to provide documentation?
So Task actually manages that as well. And there's a Task app, and they can have like set up recurring, like if you have a recurring premium, just like your Part D people, we have to have them fill out a form, submit the initial invoice that they get, and then every month they get that back without having to keep re-providing it. So if they go and pick up something, they can swipe their debit card. Sometimes they might have to justify their thing, and it's a quick photo on your phone or going into your computer.
And then my last question would be, is you said if we pay the 180, it's cheaper than if we had to do what?
So
we
then if you
didn't
put
do
them
that-
on their regular plan, they still have to get Medicare by law, right? Otherwise, they will be personally penalized.
Correct.
And their Medicare, when they are no longer actively working, is primary coverage.
Right.
So if you're saying to somebody who's actively working, who's now retiring, you're saying, oh, we're paying like $800 a month and we're giving you $6,000 in HRA funds. Okay, so I'm going to retire and get that. Well, that's way more money.
Right, but we wouldn't do that. We could just say we're paying that Part N policy for you, right?
You could do whatever you want.
We could do that.
But what I'm saying is, if you promise them something while they're working and you say, oh, we'll cover your insurance when you retire, like a state worker or a city worker, even the state, when you turn 65, you're kicked off their state
Yeah,
plan.
I'm
and
not
they-
talking about anybody we currently employ. I'm saying at January 1 of 26, we hire an employee. It's theoretically possible, then we could say we're gonna pay your Part N when you retire, which we could go through you, and we'll do the 1,800 for drugs, but we're not paying the 185 for your Medicare.
You could, you can choose not to do it. They have to get it no matter what.
Correct.
Yeah.
So I'm talking about that argument with, and I'm not saying.
If I was the
agree
one
with it, I'm just making sure
retiring-
I understand it. If you worked 40 years for the town and we retired and we gave that to you, or you worked 40 years for Benoit, or you worked 40 years for Carver and you retired, you're not getting that 185. So it's just a perk we're giving to town employees. And most municipal employees, I agree, get it. I would get it at the county. He gets it at the state.
Right.
I know they actually get it reimbursed through their social security, right? A state worker gets
It's
it
taken from the social security and reimbursed in.
in your pension. Right, and I'm not exactly sure how the county does it, but it's similar to that.
Yep.
So I just want to make sure that I understand it so I don't sound like,
You could even, so if I was retired, I would hope that you would just say, oh, I'll cover your Part B at the end, because I can go get a free plan. For me personally, I don't care to have, I don't need a plan N, right? I could just have a free plan and the town's paying I have to pay the 185 no matter what.
Right.
Right? But there are options for people to have no monthly premium on an Advantage plan on their own, right? Without the town. So if it was me and the town said, hey, we want to give you this job, and when you retire, this is a benefit, we'll reimburse your Part B. I would take that before I said, give me Plan N,
Okay.
Yeah.
Yeah.
right?
And then back to current employee plans, the plan is suggesting is the best solution.
So your HRA, a measurement of how well the strategy is running is how much of the HRA you're actually using out of what you allocated. If you're running at 50% or less, the strategy still works. If you start to pay out more in HRA dollars, you may as well just move to a copay type of plan. But then, you've already kind of set a precedent. People are going to be mad. They got mad when they had to pay a difference, right? They didn't have to pay the first $12,000 worth of care. You covered that. They paid nothing until that point. Before, they were making copays. So you could change your strategy if you felt that you were spending more money to give out of pockets than you would be on a plan premium.
Yep.
But right now, you're still under that 50% threshold and you're getting ready to renew.
Right.
So the strategy is still.
Well, you're the professional, so
And if,
I know nothing
if
about
for
it.
some
I trust
raised,
you.
if you, for some reason raised the, cover the maximum out of pocket, history has shown that it wouldn't have a huge cost to the town, because we don't even reach.
But all the years, it only happened one
Right.
time.
Yeah, right. Just once.
So if you could
That
raise it
maximum,
up,
it
and if
wouldn't-
nobody used it, it never got spent anyway.
Right.
But
So
if you
the
raise it up,
chances of it, increasing your premiums is not very, history shows it's not very high,
Right.
because people go from between the 12 and now 13.
So we'd have to add 40, or we'd have to add $55,000 to it because it's $5,000 more and there's.
Yeah, there's 11. There's 11 people.
So how many singles? One,
4.
4 singles, so it would be less on the singles, whatever that is. So 4 singles and the rest are at 55.
Well,
The singles goes up.
when do we need to, what's our thoughts on that? Like,
Well, the HRA, what was it, 126,000?
Yeah.
And we spent 51,000.
Right.
So we raised that to 175.
You still only spent 51,000.
We still, we're still at
And maybe
51,000.
$600 for that guy.
Yeah, right.
So,
You have the exposure that it could cost you more,
My,
but it's
my
unlikely that it
personal
will.
opinion is, it don't do anything this year, and if the union, we need to explain how this works to the union moving forward. If they want to negotiate something different, then we can negotiate that and change it next year and just say it'll change after this year. I mean, tell me if I'm sounding
Does,
ridiculous, but
well,
like
the-
keep
the-
the current plan and then,
it doesn't change the plan, right? It just
well,
changes
change. Size.
out for the budget.
Correct.
So can an
Right,
HRA,
you can have it amended, but permission by the insurance carrier that is managing that product. So you can amend it, but it creates a little bit of a conflict because now you're amending something that are, it's their contract year is for the year. And if they amend something, it changes it going forward.
I mean, I think in the contract negotiation, you would just be like, yeah, we're willing to do that, but it's not gonna start until September 1st of 26.
Right. It's like, so like if it happened to you and then the town says, oh, I want to amend it, it doesn't help you. You already incurred the claim,
Right.
amendment goes forward. So
Right.
so the percentage increase from this year to next year for current employees, what is that percentage?
it is
13.9.
I calculated
13.9. It's on the,
13.
it's on this page.
When do you think that stops?
I don't know. I was on the phone with the minority leader in the Senate today talking about it, but This,
Yeah, I calculated this. but I'm
yeah,
not figures.
it's here.
Just a minimum, that is.
No, the 13, these double-digit increases are gonna eat up our entire 2% tax deficit. I mean, it does it now, but it's probably not even close, but I mean,
What's our total cost here?
13%, I don't know what it is.
So the first part of this really talks about all your MVP active people, the HRA allowance and costs, the dental corporate-wide, the vision corporate-wide, minus the employee contributions that people are paying. Your annual cost is 306,883.11. Line down says it does not include your Medicare costs. So under that in yellow, I gave you, based on the 21 people, what your current so you're currently at 136,332. The only thing I've heard is that the Part B is going to increase by 11%. And it's not confirmed, I've just heard that. And I have no other 2026 information yet.
So is our total about 442?
Minus whatever HRA allowance you do not use. And yet you would budget for that, but your actual cost is 60,000 less.
But it's 306 plus 136 approximately.
Correct. Until January. And then you have to, for your budgeting purposes, you're gonna have to account for what the Medicare 21 people's increase is going to be for Part B, if you decide to continue with it, and the Plan N. And they haven't released it yet.
Well, we're gonna continue because we say they're giving it to, right? It's a
11,
matter of
roughly
going into union
11%.
negotiations, what we do for future employees moving forward.
And you would guesstimate that around 11% increase
On the Part B premium.
So then maybe sometimes in the sake of time and everybody can go home normal, maybe sometime you could explain to me and we'll talk. I don't wanna do it.
Yeah, I mean, I'm
Maybe
happy
you
to
could
do a
explain
workshop.
to me what the advantage is of us paying $205 a month for the Part N or $206 a month for the supplemental versus just telling them to go get the free plan. What's the benefit? But
You're limiting their out-of-pocket costs and you're managing the bill for them. Bill comes here, not to them. When left to their own devices, I will say it was a very to move all those people to their parties. And some people still just don't get it. It's taken some time, right? So whenever you change anything, if you go back to saying, hey, we're just going to give you a fund, go do your thing, like Greenville did, it took some time. I'm willing to do it. It took some time. I worked with each and every person to go through their needs and their costs and everything. And at the end of the day, the sick people that needed those supplemental plans used their fund for those plans. The other people just used it to pay their copays. They got a free plan and they just made their copays out of that money. They were happy.
yeah, I guess it's just trying to, like, the disadvantage of a free plan versus us providing the plan in. Like, that's hard to understand.
One other thing on that is that the reason why this family went over the $12,000 because they are not aware of the way the plan worked.
Right.
So they both decided to get surgery, said, I'm not saying this is true, but they both decided to get surgery or whatever, a month apart.
Right.
So instead of waiting,
But let's keep in mind, you don't wait for surgery.
I mean,
well, if it was elective, right? That's the only reason why we came across that.
This wasn't.
in fairness, I will say that I have spoken to every single employee many times over throughout the year, every single year, when I come to the dump on Saturday. They pull me aside and ask me questions. Sometimes I'm in town, they ask me questions. They come to my office, they ask me questions. I have done employee meetings I have gone through, they get this stuff mailed to them as well. So it's been said to them and they were aware of it. They just might have not understood it.
And I totally agree with that. My problem is when it happened, none of us were aware of it either.
Yeah.
Like, we just say, okay, and that's partly our fault, because I'm the biggest culprit, right? I do this with the budget. I'm like, Brian, is the budget good? Yeah, we're sparing money, perfect, right? Aaron, is this the best plan we have? Yes, perfect, okay, I trust you, but then I don't understand it, so when they come to me and say, I'm like, doesn't make any sense, we have an HRA, but that should pay for that, I don't understand why you're paying out of pocket.
Yeah.
Now, I'd understand it, and I probably would feel better, like, if when it comes to the union contract, that was spelled out, so that they, and then, if it's clear there, that it's a contract that they signed, that's their problem. Like, no, it's right there in your contract,
Right.
and at this time, they come and talk to me, then we've got John, and we all stood here, but it doesn't seem right, because we have that HRA, and that's what it's covered.
But
When
the
it-
problem
yeah,
is, though,
yeah.
that none of this is spelled out in the
Agreed.
employee contract, not a word of it.
I know, which it should be in part, should
It
be.
should be, yes.
Yes. So I think then, and that will change moving forward.
Lastly, your dental and vision have no rate increases. They're just flat. So good news there. And then I wanted to,
We'll
Just-
we'll buy you a car when our medical is no increase.
Okay. Not chocolate. So as I always tell you, there's basically 4 insurance carriers to pick from. I have the Blues rates here. They're always higher anyway. So 2 Blues companies, their rates are usually a little higher. MVP and CDPHP are the 2 that are very comparable to one another. So in fairness to you, I just wanted to make sure to bring the CDPHP rates to you too. So if you thought that you might have wanted to make some type of a change, I brought them if you wanted to look at them.
Are the rates the same, close?
So like for the bronze plan, their high deductible EPO. So your MVP is going to go to 763. Theirs is at 817.
So is there anything that you know of at CDPHP? Nothing that you know of that makes them better?
They're very comparable companies.
Then why go through the aggravation?
Just wanted you
Yeah,
to
No, I know.
know.
I like having it, but that's always my question is there an advantage? Are we doing better by our employees by doing that? Are we doing better by? the
You
town?
actually have a little bit better of a national network. So if somebody were to get very ill and needed to go to some specialist, MVP uses Cigna, which is a large national network. And the ID cards have the Cigna logo at the bottom. CDPHP contracts with 2 carriers. Their logos are at the bottom too. One's for the New York City area and the other one is for everywhere else. But they're First Health and MagnaCare. They're not as large as Cigna.
Cool.
I love my CDPHP.
I was with them today too. I had a very busy day. I just gave a 19% increase to the Desmond Hotel this morning. So it's been a long day of bad news.
Yep.
And then I was late, but I redeemed it with chocolate.
Right.
Oh, you have more chocolate?
Just that. When you're done, let me
Making it
know.
up with chocolate.
Thanks for being patient.
You're welcome. I mean, if you guys throughout the year have free time, I know nobody really has a lot of free time. I'm happy to do a workshop, to kind of review things with anybody that wants, even if it's just one-on-one and somebody says, hey, can I talk to you about this again? I just want to understand it or whatever.
Yeah.
I'm happy to do it. Jill pens.
How soon can you do it?
Whenever you want.
I need to review this.
Just thinking we should probably do it sooner rather than later, because we're gonna go into union negotiations at the end of August, so.
Yeah, I can put something in I'm pretty wide open the month of August. All my vacations are behind me now, so.
Okay,
So just let me know.
we will.
whenever you want and I'll put it in my calendar.
So really, it's done for the complete contract. It's really all you would have to include in the language. And then everybody knows what's going on.
Right?
All right,
So
thank you.
by ish is when you should at least have some decision. You should have it done 2 weeks at least
I'll
before
make a
the,
motion that we authorize the supervisor to sign healthcare agreement.
I'll second
do you want to talk about the HRA or you
it.
can
No,
just
I'll
It's done
put-
now.
Yeah. What do you need?
We're gonna authorize it now.
I meant the same amount?
Yeah, for now, it's in the way it is, and then we'll worry about it next year.
Okay,
I think it was that we authorize the supervisor to sign, whatever agreements are needed to continue healthcare for September 1st to August 31st of 26.
I seconded it. All in favor?
All right.
Aye. Motion carried. Thank you.
I'll bring those papers to you to sign personally.
Okay, can't wait. Any audience comments, please?
2 quick things. The air conditioning, I will work with Vicky on getting somebody to come in here and look at that. We had talked earlier, you said you didn't think it had to be heat. When you do mini splits, they're heat pumps. So you don't have like an air conditioning only or a heat. You do a
Okay.
heat pump that does both. Then you will be able to run those far into, we already have a good rate on our electric. It would that, then it would be the heat and oil.
Okay, I didn't know.
So advice would be to I can work with Vicky, or if she's got somebody already, I don't care. I would just have one person come in here and, or we can have a bunch of people and say, but we're gonna have to go out to bid. Like, that's the question I have is are we, like, what's the best to cool the room? And, have them give us proposals, and then we're gonna have to pick a proposal and go out to bid, because assuming it might be more than 20 grand.
Sure.
Does that make sense? So I mean, I think probably the best thing to do is, in my opinion, would be to just come here and not tell them where you want units. Just come here and say, we think the easiest thing to do would be to put splits in, because they're easy from the outside, you just put them in. But you're the professional, what is the best way to cool and heat this area the most economical way?
And he'll tell you 2
Yes.
splits or 3.
Or he'll say,
Right.
put ductwork in and have 1 unit, it may be that, I don't know, so. I can work with you on contacts and.
If you want to be technical, it's not legal to do that. You need to get a quote, and then the quotes need to specify what you're asking for. I mean, otherwise, you're simply asking for a request for a proposal, which you can't do. You're gonna ask for a request for a proposal, and then they can understand. They would explain, the contractor would explain what their intent was and what the costs were.
And then that request for proposal.
Yes.
That's fine.
You can't just
Okay,
say, hey, Joe, and tell us how to air condition this building and accept their price. You can't do that.
No, I wasn't suggesting that. I was
But we
suggesting
can
that,
have
they give
Adams
us-
Heating and Cooling.
I actually was suggesting that they give us a proposal on what to do, and then we would put it.
yeah,
Yeah,
Okay,
you have to
that-
have a proposal first, else your bid procedure has to specify exactly what you're asking for.
Right.
Brian, this building, what does this consider? Remember, we had to get the generator because it was supposed to be a command center or,
It's a town, it's a municipal building. I don't believe that it's specified as anything, right? That it can be used as a shelter, it would be a terrible idea, because if there's a disaster in the town, this is the hub of decision making. You don't want people, lounged out here. Could we use it? Absolutely.
Yeah.
In a disaster, could we use it? Certainly. But at the same time, it would be something very short term till we kick them somewhere else.
Okay,
So you're not gonna find any law to justify it. My justification is we have several employees that work in here and it's hot, it's ridiculous. But at the same time, a heat pump will help us a little bit more beneficial in the fall where we don't have to run oil at $3.75 a gallon to heat the place. You could just set it for, like, I'll be honest with you, with the heat pumps work to like -30, which it never gets here. You could heat this room to a constant 60, and instead of turning it up the day of or keeping it up high, you could, when we have meetings, you could come back and bump that thing up and it would be 70 within 5 minutes. And then when you leave, bump it back down, keep it to 60 in here or whatever,
yeah.
and it would be
Well,
fine.
they're awesome. Those mini splits are awesome.
Oh, yeah.
I just got them.
Yeah,
Yeah.
they're outstanding. So, and then the only other thing that I had was, I didn't talk to you, I wanted to catch you was, so last month, Bill come, he had nothing to talk about, and we had nothing for him. I just feel like when we have those first meetings of the month, if you know nothing is coming up, like making that guy drive all the way out here is ridiculous.
But how do you know, Brian? How do you know what's gonna come up? How do you know what audience comments could be made?
Like,
You know,
yeah, I just don't think it's anything that's that important that you would have to have it right then. I mean,
well, we're paying for it.
I don't think we are paying. We have a retainer, and if we don't use it
Well,
up,
I mean, they're pricing that into retainers, don't you think?
I'd have to ask. I mean, I don't know, just to make somebody drive out here just to say I have no report and we got nothing for them to drive back in, it's disrespectful. I don't know that I wouldn't want you to do that. I wouldn't want anybody else to do that. I know we
Well,
pay them for
if
them, but
we're paying them the firm, a considerable amount of money for legal fees. And I wouldn't be comfortable doing that because if we're gonna have an attorney, he should be present at the meeting. Because we don't know what's going on. We know what the agenda is, but how often do we actually follow an agenda?
we always follow the agenda.
Well, yeah, but it digresses. So that's my opinion. You know, it's like,
Yeah,
it's not,
And Brian, thanks for covering the meeting,
no problem.
so.
Yeah.
I got a new grandson that day,
Congratulations.
it was wonderful, that night, actually.
He's insured, don't worry.
Huh?
I've already got him on insurance.
Oh, do you? Oh, my wife contacted you, apparently.
Brian, make a motion.
I made a motion to adjourn.
Second.
All in favor? Aye, thank you. Motion carried.